Hello and a big warm welcome to day 4 of the pregnancy challenge. I am so glad you are here with me, joining me on this beautiful journey to help celebrate your body and your baby and to help nourish and nurture what is going on with all these beautiful changes. Today we are doing optimal birth positioning yoga. So it's going to be a nice little sequence that you can start to do regularly, especially as you enter that try-3. I would love you to do this sort of sequence almost every day, but if not, at least twice a week. And this little sequence, firstly, why do we do optimal birth positioning? So during everyday life, we tend to sit in poor postures, rounded spines, spending way too much sitting, crossing our legs. All this impacts how much space our bub has within us. So bub actually has to navigate all your tight muscles, tight ligaments, tight tendons. Your bub has to navigate all the loose muscles, the tight muscles, the weak muscles. So what we want to do is make sure that our body is as balanced as possible, so it gives bub the most room possible. And this is going to help benefit baby as well as us tremendously, especially during that labor. So during labor, often women find that they might have a stalled labor, their baby is in a poor position that's posterior, maybe breech, and a lot of these positions can actually help create space so bub can get in a beautiful position so that it can make the ultimate cardinal movements to come into this world in a safe and secure manner, whilst not navigating tight ligaments or tight tendons. So that's basically the premise behind optimal birth positioning, is to get bub into the optimal birth position. Okay, let's get stuck into it. So we're just going to need a block or a pillow. Maybe you just have a little wrapped up towel today. It doesn't need to be anything crazy, but just something to keep yourself supported. Even a chair might help you against a sofa. Whatever way, I'll tell you when we need them and when we have the options. Okay, let's start off first of all by coming into all fours. Now, as you'll notice if you've been joining me over the past 4 days so far, is that already I tend to do a lot of this. And this is because I love to start every workout, every yoga flow, with just a little body recentering. This is beautiful at helping lubricate the spine, open up the pelvis, and help allow some more space to be created in our uterus for our bub. So we're just going to swing those hips from right to left. This is one of those movements that I feel that should be done every single day of pregnancy, is just to give yourself time. If you feel that your wrists are a little bit niggly here, you can always come onto all fours and just come into this position. You're just going to focus on your breath, relaxing that face, relaxing that jaw, and just being with the body, being with your baby. And then we can start to bring in a little bit of a hip circle. Again, just to create some more space in the body. You move from clockwise to anti-clockwise. Just go with your body here. Don't watch me at the moment. Just closing off the eyes and feeling the body. Focusing on the inhalation and exhalation. And just being really gentle with the body. Okay, as we come into stillness, we're actually going to start off with a standing position. So we're going to start off bringing our feet just outside our hips because we need extra room for this bump to come through. So you're going to be a little bit wider than you normally would. I want you to place your hands on your belly to start off with, closing off your eyes and just swaying with the body. Really reaching that top of the head nice and tall, as if we want to get our spine nice and lengthened. Not overarching that lower spine, like not kicking our hips forward too much. Just creating space within that body in that standing position. Swaying those hips from right to left. And then as we gently come into stillness, we're just going to start here with 2 breaths, allowing our belly to expand. And then gently feeling our tummy full. 1 more breath. And then exhaling Beautiful. Okay, we're going to start by bringing our legs nice and wide now to the length of your mat, so we're on our side. You're going to bring in your bolster, your pillow, your block, your chair, whatever you have at your disposal. And we're just going to hinge from the hips, sticking that butt out nice and long behind you, and placing your weight on your block or pillow. Again, you can even do this on a sofa or a cushion. So we're going to start off with some windmills here. This is a beautiful one to help open the back of the sacrum. So just this part at the very, very, very lower back, which helps open up the bottom of our uterus, which creates more space for bub. And as well, we're going to inhale, lift up the arm. And what we're doing here is we're stretching out those obliques, opening up the whole side body, again, creating more space for bub and helping release some of those tight muscles. Exhale, coming down. Inhale, lifting up. And exhale down. Inhale, lifting up. Exhale down. Inhale up. And exhale down. If you feel like you can lower the block here, then please do. Don't push or strain yourself. Otherwise, keep going at exactly what pace you are already. Inhale, lifting up. Perfect. We want to keep your spine straight here, so no rounding of the spine. Exhale down. Inhale up. And exhale down. And just pausing here, we're just going to hang, keeping that spine nice and straight, nice and flat, as if you could rest a cup of coffee on your back almost. And just breathing here for 2 breaths, allowing that sacrum to fully open up and expand, allowing the back of the hamstrings to open up and expand, and creating space within that whole body. From here, you're going to use your block. You're going to turn it up either this way or sitting down like that, whatever you please. And we're going to come down into a low squat. So first of all, placing right hand and left hand onto your legs, curling the spine, lifting up, inhaling straight into the sky. And then exhaling, we're going to come gently down into this squat position, seated onto your block. So our toes are really turned out here. We really want everything to be nice and wide, so we've got lots of room for our bump and baby to sit in between our legs. Now this can be quite challenging for a lot of people, but this is one of the most beautiful positions you can get in during pregnancy and even labor. This position helps build birth stamina, so it is great at building strength. It's great at strengthening the pelvic floor, but it's also amazing at helping relax and stretch the pelvic floor. We tend to generally have really tight inner thighs as women because we're often quad dominant. So we often use our these front muscles a lot more than our inner thighs. So it's really important to stretch and strengthen these inner thighs, and this is exactly what this is doing. So with our squat, we're going to keep our chest up nice and tall, bringing our hands into prayer position, into our heart center, and just breathing here with our body, being really gentle with yourself, not forcing or straining, keeping those toes turned out. Initially, we might want to start with, say, 1 minute holds here, but then as you progress in pregnancy and as you get closer to that due date and as you get closer with having birth stamina in this position, then you can build up to maybe 5-minute a day squats. This is one of those positions that I would love everybody to do every single day. So again, we're going to be here for a few more breaths, opening up that whole lower body, creating space in the uterus for bub to move around and get into a beautiful birthing position. 2 more breaths. And last one, being really gentle. Perfect. And then we're just going to gently release. You're just going to gently pull out the block or pillow, whatever you've got from underneath you. placing it onto your side. And then we're just going to come into this all fours position. And to help recenter our hips, our pelvis, you're just going to do that hip sway again. Just swaying those hips, being really gentle. Again, if you need to rest your wrists, then please come down onto your elbows. Okay, next up we are going to grab the block or pillow, whatever you've got, and just placing it underneath your left hand. Your right hand leg is going to come nice and wide on the outside and toes turned out into a low lunge position. So it's like proposal position. From here, we're just going to come forward, opening up the psoas muscles, opening up the hip flexor, opening up your whole inner thighs, closing off your eyes and just coming forward and back into this movement. You can move those toes from out and then move them in. Low lunge is again really great at creating strength, birth stamina, but this is a fantastic one you can even use in labor. So generally for women that are finding that their labor is stalling, so if you're laboring and then all of a sudden nothing, and you're found that you're not progressing, then this is a really beautiful one that you can actually bring into your labor to give some more room for bub, because sometimes when birth stalls is the fact that actually bub is stuck on a tight muscle, tight tendon, not effectively stuck, but just trying to navigate its way through, and it's got a little bit of trouble getting the way through some tight muscles, tight ligaments. So this is a really good one to help open that whole uterus, the pelvic floor, and to help relax those muscles. Okay, coming back down, placing the right leg down, placing the block on the right hand, left leg out to the side, and now we're just going to do the left side. Opening up that leg and just playing with it, coming forward and back. Closing off your eyes if you need to. And just feeling the body, feeling the breath. We'll do it 2 more times. Out. Beautiful. Okay, coming back down. We're going to come to those hip sways again to recenter that pelvis, recenter the hips, to lubricate that spine. Just being gentle with the bub, gentle with your body. Maybe you almost want to just dance here with your whole body, just creating fluid and movement within the whole spine, allowing everything to open up, that side body, those obliques, opening up that sacrum. Okay, and as we come to stillness, you're just going to bring your knees, so we're going to be knees nice and wide, beyond hip distance to allow room for the bump, but then your feet are just going to be splayed out just slightly wider than your knees. And all we're going to do from here is we're just going to exhale and push back. Inhale, coming forward, making sure that spine's staying straight, so not overarching or swaying that back. So exhale, pushing back, and inhale, coming forward. So again, this is a beautiful position to help open up that uterus, open up that deep sacrum joint, and to work with the pelvis and some of those tight and very weak muscles that generally a lot of us have. This is also got an added bonus of really stretching that perineum. Beautiful. Inhale, coming forward, making sure that we're not arching that spine. Exhale, pushing back. Inhale forward and exhale back. Last one. Inhale forward and exhale back. Just to note also, this is a beautiful pushing position. So if you can remember when you're in labor to bring your knees in, feet out, and it really helps engage that pelvis, turning it out so that bub can really open up everything at the pelvis here and exit beautifully. It can help reduce tearing. So it's a really, really, really good position. Okay, coming onto your knees now for a minute. We're just going to shake these hands because we've been doing a fair bit on our hands. And then we're just going to come into our last pose, which is a simple glute stretch. Now, if I can give you 2 recommendations for the whole of pregnancy, it would be to stretch your glutes and do squats. So this is, again, you will see probably in most of my workouts over the next 10 days that I will be doing a lot of glute stretches. So we're going to keep your chest up nice and tall, making sure that we're not arching or sending bub back to our spine. You do not want spine on spine. Chest up tall and bringing this leg to a 90-degree angle and just breathing here. Maybe you can reduce the angle that you have here. Again, this is really beautiful. It's helping open up this uterus, helping stretch a lot of these tight ligaments and tendons and repair some of the damage that we do from sitting too long, but also sitting in that banana shape at night. So often when we're watching Netflix on the couch, we tend to just sit in a slouch position. And this is a no-go for pregnancy because not only is that going to promote back pain, hip pain, sciatica, but it's also going to get bub into a really poor birthing position. And it will be spine on spine, posterior position. Swapping your legs, bring your right leg over your left, bring that 90-degree angle, chest up nice and tall. This is also a really beautiful stretch if you're experiencing sciatica. And breathe. You might feel that one side's much tighter than the other, like me right now. And just breathe with it. Maybe you want to create a little sway. Beautiful. 2 more breaths. Perfect. And then you're gently going to come down. We're going to finish in our child's pose. You're going to exhale, push back, knees nice and wide to allow room for that bub. Placing your chin, your forehead onto the floor. You can always use your block here if you want to come up a little higher. If you're in that 3rd trimester, you probably need to come up a little bit higher. So you can place your forehead onto the block. If you're experiencing crazy reflux, and just sit up like this, please. Just breathing here with it. Your knees nice and wide. Allowing the whole body to relax and melt down into the floor. Relaxing that face. Relaxing all the tension held between the eyes. Last breath, inhaling gently and exhaling gently. Beautiful. Beautiful. Thank you so much for joining me on today's Optimal Birthing Position Yoga. I really hope you benefited from this. And this is one that you can click save on and do as many times as possible. I urge you to at least, especially as you enter that 3rd trimester, do this at least once or twice a week to help open and create a bit more space in that body with bub. So tomorrow, I really hope to see you here for day 5, where we are going to be doing a full body workout on the ball. Please don't forget to hit subscribe so that you can stay tuned for the whole rest of the pregnancy workout challenge. I will see you tomorrow. Bye.